Good morning. This is your April 25th coronavirus update. I can't believe I've been doing this since March 12th, I think. It was my first video, so it's been a long time, or maybe even March 10th, I think. So I've been doing this every day at first, and I went down to twice a week, excuse me. So I'm keeping with that right now because the crisis keeps on evolving, but it looks like hopefully things are getting better globally. So let's look at top 10 lists. I keep on changing things just to brighten things up a little bit. So this is to try to be more positive. Let's look at the top 10 in lowest prevalence per 100,000. So if you recall, prevalence, you take the number of current cases, and that's not always easy to do because sometimes you have these data dumps. At a data dump is when a public health department or some surveillance organization takes a bunch of data and dumps it into the data set on a day. Like I saw that in Sweden today. There's a big data dump. So we see that, oh, okay, there's a lot of people have recovered. So it might have taken a while for them to accrue those data and to put them in some kind of a spreadsheet. But that said, let's look at where the top 10 lowest prevalences are. So the prevalence, again, is the current cases divided by the total population, and then we multiply it by 100,000 so you don't get these really minuscule proportions, and it also gives us some kind of a context. Now, I know there's also a lack of trust with certain countries, like China, for instance, is one where right now there's a lot of lack of trust because there's a belief that data weren't being reported accurately. There's nothing we can do about that. They won't allow for an external investigation. I don't blame them either. Who would allow another country to say, hey, you guys are cheating? I mean, I don't even think the US would allow that either. But right now they're leading in this top 10 with the lowest prevalence. So that's like about 0.07 cases per 100,000. Dang, that's small. And so look, if you think about that, that's really, really small. Taiwan, we know, is doing really well. There's been a lot of documentation of what they're doing to prevent the spread of the coronavirus. I trust Nigeria a lot because of Nigeria's work that they did with Ebola. They did an outstanding job. Also goes to show you how money can influence a response to an epidemic. India is quite low. There's some concern about India with the record keeping, but it's the second largest country in the world. But right now, this is where we are at 1.29 individuals per 100,000. South Africa is doing well, pretty well. Again, Mexico, it's 3.49. It's up to you if you are concerned about some of the data keeping in countries that have less money. But these are the data as are provided by the Johns Hopkins University Global Tracking Coronavirus site. We know South Korea is doing really well. That's been documented. Argentina, that's where my father's from, so that's why I've been keeping it in the list. I'm always interested in my family down there. Argentina has had a very, very strict and positive response to this. The moment the first cases came in, they were like doing lockdown, so I can see why they would have a low number of cases per 100,000. Australia and New Zealand, you'll see that there aren't any European countries in there, right? You notice that? So as you're thinking about your vacations in the future, where would I want to go? I might be thinking about, say, like Australia, New Zealand, South Africa, Argentina, Taiwan, China. So there's difference. Again, if things get better and places open up, these might be some of the first places to open up. In contrast, we look at the worst situations, top 10 worst in terms of prevalence. A lot of these also have to do with the size of the population, so population density. So there's been a change in the past few days because of data dumping, especially with Luxembourg. Luxembourg always was one of the top, having the highest prevalence, but this data dump with the number of individuals who've recovered has actually changed that. So now we have Qatar at the highest with 292.21, maybe 22 individuals per 100,000. Belgium, United States, Spain, Portugal, Netherlands, UK, Italy, Ireland, Sweden. There's something very interesting about this list. Pretty much all European with two exceptions. So again, thinking about where you have the greatest number of cases, now one could argue, wait a minute, these are probably where the most testing are being done. Yes, that's a possibility. So it's really hard. One thing I've learned during this whole process in terms of surveillance, when we do surveillance for diseases, surveillance is when we actually accrue information about diseases so we can calculate prevalence and incidence. Incidence is the number of new cases, etc. To do that tracking, we rely on either direct or indirect surveillance. Where direct surveillance, we go ahead, active and passive, I think that's what we call it. Active surveillance versus passive surveillance. Passive is where we rely on others to report information to us, like from the field. And active is when we go out and actually collect data, and that's not what we're doing. We're relying on passive surveillance. People have to report to us, and different places you might have different abilities to report. You might have different reliabilities. You might have people are too busy where they can't just do the reporting. So that's when we get these data dumps, and it's a most complicated thing you can do. So if you trust data on any disease, you're wrong. I hate to say that. It's just because humans are not able to keep up with this massive amount of data. It's just impossible, because we also rely on people coming in to be seen by healthcare providers. What if they don't? So these are the best data available, best possible data available. Our colleagues at Johns Hopkins University they look at all the different possible sites reporting data, the best possible sites globally. That's why you'll see the Johns Hopkins site is the one that's cited the most. Site with two different ways of spelling site, right? They're cited the most when it comes to the coronavirus pandemic. So, but these are important numbers here to think, well, what am I going to do in terms of my traveling? Are these places good places to go? Even the United States. Now, in the United States, most of our cases I've done this before, are in the New York, New Jersey region. About 50% of all cases are there in the U.S., so we'd have to actually look at our country very carefully. There's a lot of regionality in this disease. How about the top 10 lowest case fatality? Case fatality is the probability of dying if one is a confirmed case of the coronavirus. Qatar is the lowest. They have the highest prevalence, but was that right? Yes, look at the highest prevalence, but the lowest case fatality. So I bet that has to do with hospitals per 1,000 individuals. Same with Kuwait, Saudi Arabia. Interesting. I see a trend over there too, right? Middle East. You have Russia, Australia, New Zealand, Israel, Taiwan. Taiwan we know about already from all the articles talking about how their strict response. Chile and South Africa. So if you look at this, you'll see that there again are trends with certain countries that are very reliable healthcare services who've taken advantage of, who've actually acted appropriately in response to this disease. They're doing the best. And then, of course, the worst in terms of case fatality, we have Belgium leading the list with a 15% chance of dying if one is infected. France, UK, Italy, Sweden, Europe, Spain, Mexico. There you go, Mexico, 9%. Brazil, about 7%. In Iran, about 6%. So what we have here is what the top 10s are in each of these lists for the current situation. A quick look at some of these other figures. I'm looking at this one in particular where we're comparing different countries in terms of their prevalence per 100,000 and tracking them. See, I see this big dip right here for Sweden as a data dump where you have like, oh, these people have recovered and they're all dumped in here. So you see a lowering of the prevalence. So I'm not so sure if that's an actual lowering of the prevalence or just a byproduct of a data dump. You see a lot of these dips here in Spain as well. U.S. is climbing and climbing. And Italy is looking like they've, if you like that term, flattened the curve. Looks like they are flattening it for sure. So that's good news for our Italian friends out there. And it just as a reminder, if we look at, just as a reminder to understand why we see these massive gaps in terms of case fatality, this figure of mine shows the proportion of individuals 65 and above in a country relative compared to case fatality. So you can see case fatality kind of mirrors it, except that there's also this really interesting chart here these lines that look at the number of hospitals per 1,000 in a population, and where they mirror the proportion of population 65 and above, you see decreasing numbers of fatalities, like we saw, for instance, some of the countries like Israel, Chile, South Africa, Luxembourg, even though having a higher prevalence, they have a lower case fatality. Norway, where in the countries where we see the worst case fatalities, Belgium, France, UK, Italy, Sweden, Netherlands, you have this gap over there, big gap. And then this last line down here is your population density. And I ran statistics on these data analyses using regression analysis, and including some interaction terms where I was trying to predict case fatality, and this variable here, 65, is the proportion of the individuals 65 and above, so that's positively related to case fatality, and then hospitals per 1,000 is negatively related to case fatality. The interaction is not significant. It changes a lot depending on the day to day. That's why I keep on running this over and over again every single day. When I use my index, the HB65, which is the proportion of well, it's actually the hospitals per 1,000 divided by the proportion of the population that's 65 and above. You have this really distinct line here. You see this divergence from, so here this is that HB65 ratio, as I call it, HB65 index, and then this is the case fatality. So countries like Belgium and France, you have it's lower, right? And you have this greater case fatalities versus countries like, say, Serbia, Chile, Luxembourg. There's this big gap here, and basically you have lower case fatality. So there's better preparation to take care of individuals. When I also ran that that specific analysis, and again, this HB65 does a great job at predicting where you'll have more or less case fatalities. Now, just a caveat there is I do control for population density. However, I would like to add more countries in here. This is only with 44 countries, so I need more in there. So I'm working on it. But anyway, have a nice day and please be safe and happy weekend.